4 blood pressure drug errors that could shorten your life. Would you like to know why hypertension is dubbed the silent killer in modern medicine? And why some people who appear completely normal on the outside with no obvious symptoms can still face the risk of stroke, heart attack, or kidney failure simply because their blood pressure has been elevated for a long time without proper control? In this special section, we will dive deep into this condition that affects so many people but is often misunderstood, so that you can proactively and effectively protect yourself and your loved ones. What is hypertension? Hypertension is a condition in which the pressure of blood flow against the walls of blood vessels remains consistently higher than normal over an extended period. This pressure is referred to as blood pressure. When the heart beats, it pumps blood throughout the body via arteries. If the blood vessel walls become narrow, stiff, or constricted for any reason, the heart must exert greater force to push the blood through, and that's when blood pressure rises. Blood pressure is typically measured using 2 numbers: systolic blood pressure, the top number, the pressure in the arteries when the heart contracts; diastolic blood pressure, the bottom number, the pressure in the arteries when the heart rests between beats. According to the World Health Organization, WHO, and the Vietnam Ministry of Health, an adult is considered to have hypertension when systolic blood pressure is 140 mmHg or higher, or diastolic blood pressure is 90 mmHg or higher, or both. Is hypertension dangerous? The answer is extremely dangerous. But the danger lies in the fact that it doesn't cause noticeable pain or dramatic symptoms like other diseases. Many people only discover they have hypertension during a medical checkup for another issue, or worse, after experiencing a stroke, heart failure, or heart attack. If left uncontrolled, hypertension silently damages vital organs in the body. Heart damage. High blood pressure forces the heart to work harder to pump blood, leading to an enlarged heart, heart failure, and an increased risk of heart attack. Brain damage. High blood pressure increases the risk of stroke due to ruptured or blocked brain arteries. Kidney damage. It harms the small blood vessels in the kidneys, reducing their ability to filter blood, which can lead to kidney failure. Eye damage. It causes damage to the retina, resulting in blurred vision or vision loss. Metabolic disorders. It contributes to conditions like diabetes, high cholesterol, and obesity, placing additional strain on the entire body. A 2020 report from the American Heart Association revealed that 6 out of 10 stroke cases are directly linked to uncontrolled hypertension. This further proves that this condition cannot be taken lightly. Why do people develop hypertension? There are various causes of hypertension, which can be divided into 2 main groups. 1. Primary, essential hypertension. This accounts for 90–95% of cases, meaning no clear cause can be identified. However, several risk factors contribute to the condition. Age. As people age, blood vessel walls lose elasticity, increasing blood pressure. Genetics. If someone in your family has hypertension, your risk is higher. Unhealthy lifestyle. A high salt diet, smoking, excessive alcohol consumption, lack of physical activity, or being overweight. Chronic stress. Prolonged stress or anxiety disrupts hormones and blood pressure regulation. 2. Secondary hypertension. This accounts for 5–10% of cases and is typically caused by an underlying condition such as chronic kidney disease, glomerulonephritis, or renal artery stenosis. Endocrine disorders like hyperthyroidism or adrenal gland tumors. Certain medications such as oral contraceptives or non-steroidal anti-inflammatory drugs, NSAIDs. Sleep apnea. How can hypertension be detected early? Most people with hypertension have no obvious symptoms. However, some warning signs may include persistent headaches, especially in the morning, dizziness, blurred vision, or a racing heart, fatigue, trouble sleeping or ringing in the ears, flushing, palpitations, or chest discomfort. However, these symptoms can easily be mistaken for other issues. The only reliable way to detect hypertension early is through regular blood pressure monitoring. What should you do if you're diagnosed with hypertension? First, don't panic. Hypertension is entirely manageable with the right approach. Here are 5 key steps. Change your lifestyle. Reduce salt intake, eat a lighter diet with more vegetables, and limit unhealthy fats. Engage in gentle physical activity like walking or yoga. Reduce stress. Practice meditation. Listen to calming music, and maintain a regular sleep schedule. Don't self-medicate. Always consult a doctor and avoid using someone else's prescription. Take medication on time. Follow your doctor's instructions and measure your blood pressure before taking your dose. Monitor your blood pressure daily. Keep a record to evaluate the effectiveness of your treatment. An important message for those managing hypertension. Understand that controlling blood pressure isn't just about taking medication. It's a journey that combines proper awareness, healthy behaviors, and consistent monitoring. Medication addresses the symptoms, but lifestyle is the root. When you understand the nature of the condition, its causes, and its consequences, you'll be more motivated to protect yourself. No one loves your body more than you do. Would you like to know why taking blood pressure medication diligently every day could still cause your health to deteriorate gradually, potentially leading to dangerous complications like low blood pressure, heart failure, or kidney failure? There's a truth that few older adults realize. Blood pressure medication is not an absolute shield. While it helps control blood pressure, if used incorrectly, it can become a double-edged sword, silently harming your health day by day. Today, many people still make common but extremely dangerous mistakes when using blood pressure medication. These errors not only reduce the effectiveness of treatment, but also lead to a range of consequences that affect lifespan and quality of life. In this article, we'll explore these mistakes, understand why they're dangerous, and most importantly, find effective ways to avoid them. Because medication is only truly beneficial when used correctly, for the right person, and at the right time. The first common mistake many older adults make is taking blood pressure medication daily without regularly monitoring their blood pressure. You might think you're doing the right thing by sticking to your medication schedule, but without frequent blood pressure checks, you have no way of knowing if the medication is still suitable for your current condition. According to a 2022 statistic from the Vietnam Heart Institute, 25% of low blood pressure cases requiring hospitalization were due to patients taking medication regularly without measuring their blood pressure. It's like driving a car without looking at the speedometer. You don't know if you're going too fast or too slow until something goes wrong. The body of an older adult changes rapidly, especially after age 70. Liver and kidney function decline, and the ability to absorb and eliminate medication weakens. If you continue using the same dose for years without checking, the medication can accumulate, causing blood pressure to drop excessively, reducing blood flow to the brain, and leading to dizziness, loss of balance, sudden falls, or even brain injury. A 2021 WHO study found that the risk of falls in older adults due to low blood pressure is 70% higher if blood pressure isn't regularly monitored. The solution is simple. Measure your blood pressure twice daily, once in the morning before taking medication and once in the evening before bed. With an automatic blood pressure monitor and a small notebook, you can track your blood pressure daily. Consistent record keeping helps your doctor adjust your medication in a timely manner, preventing unwanted consequences. Your health deserves close attention. Every small number can make a big difference. The second common mistake is taking medication as soon as you feel slightly dizzy. This action may seem correct, but disrupts your body's natural rhythm and makes it overly reliant on medication. Blood pressure is naturally lower in the morning, and taking medication at this time, especially before eating or moving, can cause it to drop further, impairing the body's ability to self-regulate. A 2020 study from Oxford University showed that older adults who take blood pressure medication at inconsistent times have double the risk of cerebral ischemia and irregular heart rhythms compared to those who take it at a fixed time daily. Taking medication based on how you feel can cause your body to lose its ability to self-balance. Blood pressure naturally fluctuates with your circadian rhythm, lower in the morning, rising during daily activities, and dropping at night. Taking medication at the wrong time disrupts this cycle, leading to fatigue, dizziness, or irregular heartbeats. Over time, your body may become so dependent on medication that it can't maintain stable blood pressure without it, severely impacting your quality of life. The best approach is to stick to a fixed medication schedule, ideally after measuring your blood pressure and having a light breakfast. If you feel slightly dizzy one day, don't rush to take medication. Rest, drink water, measure your blood pressure, and then decide. If your blood pressure is below 90/60 mmHg, do not take blood pressure lowering medication and consult your doctor. This caution will help you maintain long-term stability rather than relying on medication as a temporary crutch. In the next section, we'll explore 2 more mistakes: arbitrarily increasing the medication dose when blood pressure isn't low enough, and combining multiple medications without oversight. These are silent but extremely dangerous causes that can push your body toward heart failure, kidney failure, and other serious complications. Stay tuned for the final part to understand and steer clear of the risks lurking in your medicine cabinet. The third equally dangerous mistake is arbitrarily increasing the medication dose when blood pressure isn't low enough. Many people mistakenly believe that lower blood pressure is always better, but the truth is the opposite. For older adults, ideal blood pressure isn't the same as for younger people. According to the Vietnam Ministry of Health's 2021 guidelines, the appropriate blood pressure range for those over 70 is approximately 130, 140, 80, 90 mmHg. Trying to force blood pressure below 120/70 mmHg increases the risk of insufficient blood flow to the brain, heart failure, and kidney failure. Arbitrarily increasing the dose not only causes excessively low blood pressure, but also damages vital organs. When blood pressure drops too low, the heart and kidneys don't receive enough blood, leading to impaired function. A 2019 study published in The Lancet found that older adults using high doses of blood pressure medication without medical guidance have double the risk of chronic kidney failure compared to those using the correct dose. Thus, increasing the dose based on assumption is not only unscientific, but also carries serious consequences. What's the solution? First, understand that blood pressure doesn't need to be forced too low. If your reading is around 135/85 mmHg, that's excellent for an older adult. No need to worry. If you notice higher readings, monitor consistently for 3 days at the same time before deciding. Then, bring the results to your doctor for advice. Don't rush to change your dose, as even small adjustments affect the entire treatment process and organ function. The fourth mistake, often overlooked but extremely dangerous, is using multiple medications without oversight. Many people simultaneously take Western medicine, traditional herbal remedies, dietary supplements, and even medications recommended by friends. This unscientific combination creates a high risk of drug interactions. One drug may amplify or negate the effects of another or cause unwanted side effects. A 2021 study by Hanoi Medical University, in collaboration with WHO, found that older adults taking more than 5 medications simultaneously without regular checkups have a 2.5 times higher risk of complications compared to those closely monitored by a doctor. Drug interactions can cause sudden drops in blood pressure, irregular heart rhythms, liver or kidney failure, or even mild strokes. These are risks that cannot be ignored. How can you avoid this? Always bring all the medications you're using, including dietary supplements, to every follow-up visit for your doctor to review. Don't start any new medication without consulting a professional. Additionally, clearly note the timing of each medication, as some need to be taken before meals, others after, and some cannot be taken together. A small detail can significantly alter a medication's effectiveness. A surprising but critical factor that many overlook. Medication isn't the sole determinant of blood pressure health. Lifestyle is the foundation. A balanced, low-salt diet rich in green vegetables, limited processed foods, combined with 20-30 minutes of daily walking, early bedtime, and a calm mindset, is the key to controlling blood pressure without needing to increase medication doses. When your body is healthy and your circadian rhythm is stable, medication plays its proper supportive role, not a burden. In summary, taking blood pressure medication isn't a simple matter. A single small mistake, such as not monitoring blood pressure regularly, taking medication based on how you feel, arbitrarily increasing the dose, or combining medications without oversight, can lead to serious consequences. To live a long, healthy life, you need to use medication knowledgeably, cautiously, and with your doctor's guidance. Remember, medication only works effectively when paired with a proper lifestyle, disciplined routine, and close monitoring. If you find this information helpful, please don't forget to subscribe to the Senior Health Vista channel to motivate us to continue sharing valuable knowledge to help the elderly community live healthier and happier every day.